Hello, hello. Good afternoon. Can you hear me now? Dear representatives of the media, we are starting the press conference for today, where the Minister of Health, Dr. Venko Filipce, and Dr. Fabio Scano, Regional Director of the World Health Organization Europe, are going to talk. After their statements, the journalists are going to be able to raise their questions through the Zoom tool. Good afternoon, dear representatives of the media, dear citizens. It is an honor at this press conference to present to you Dr. Fabio Scano, Counselor, Senior Advisor to the World Health Organization. I would like to thank Dr. Scano for accepting the invitation. Given by the local office here in Skopje, and dealing with the coronavirus. In the past days, we had several activities regarding the dealing with the coronavirus. We had meetings with the Commission for Diseases, the health centers in the cities in the country, several health institutions, several laboratories that are dealing with the diagnosis of the virus. Practically a lot of institutions and people that are included in this fight against the virus. We have discussed for the past experience with dealing with the virus and the measures and the activities undertaken so far, and of course the future steps of dealing with the epidemics. The World Health Organization is our strategic partner generally in many aspects of the health area, especially now that we are dealing with this health challenge as a country and on a global level. The representative of the World Health Organization in the country, Dr. Jihan, is giving great support, and I would like to express my gratitude for that. Thanks to the World Health Organization, we are every day in communication with the Ministry of Health, the members of the Commission for Infectious Diseases, and many other stakeholders. This support in consultations, recommendations, and donations that we're receiving from the World Health Organization, except for this, is giving us contribution of what we are doing as a country, as institution in the country, in dealing with the virus. Regarding the management of the virus on the terrain, in the field, the measures and the transparent communication with the public, informing the public on the condition of the virus in our country. At the end of January, World Health Organization has said this is an emergency situation. We have undertaken we have undertaken all the measures that the institution has said should be undertaken. We have raised the level of awareness at a higher level even before we have registered the first case in our country. In the following period, we have introduced dimensioned measures in order to protect the health of the citizens and to amortize the impact on our health system. We have been dealing with the statistics. We have shared very important information in order to raise the awareness of the citizens on the virus and to protect them from the virus. At the moment, we are dealing with a wave that is very much stronger than the first wave, regarding as a series of events, a line of events, family celebrations, where the recommended measures for the distance, for the having protective masks, for keeping the hygiene of the hands were not obeyed. I would like to say once again to the citizens, these are the measures that are undertaken all over the world in order to protect us, ourselves, our families, our beloved ones, the health workers, and the health system in general. Our health system is at the moment completely adjusted to the situation. We are following the situation at the hospital capacities, the medical staff. We are doing a rotation of the health workers in order to respond to the challenge. What is important is the support of the citizens, full obeyant of the measures. If we do this, we will be able to overcome this situation fast. Now that we are slowly going back to the normal life activities more than any time before, it is very important to give our contribution towards stopping the spread of the virus. We are all together in this fight, in this combat, and each of us is important. Thank you. Thank you, Minister Filipce. Now I would like to ask Dr. Fabio Scano, Senior Advisor of the Regional Director of the World Health Organization Europe, to address the floor.
Good afternoon, everyone. It's a great pleasure to be here. And I'd like to express a special thanks to the government of North Macedonia for inviting WHO mission to this very special time of the COVID-19 pandemic. The Ministry of Health and the WHO country office provided the critical support to ensure full access to information and facilities. And I'm very grateful for that. I would like to take this opportunity to also thank Dr. Jihan Tawilat, the WHO head of office, and her colleagues for their support to the government in the COVID response. This resurgence of cases in North Macedonia is worrisome. The lesson is that until we have a vaccine that works, we cannot lower our guard. The action taken over these days and the weeks and months to come will be critical to prevent infection and saving lives. This mission was indeed extremely timely. What we are seeing across the world is that the virus is not going away. At the contrary, it transmits fast and it kills. And we need to do whatever it takes to be ahead of it. I arrived in Skopje this past Monday to work with the national and local authority on aspects of the COVID-19 response. And the objective was to enhance understanding of the evolving COVID-19 epidemic and the impact of ongoing measures. During the past 3 days, I had a very intense agenda, which allowed me to meet with the President Pendavrovsky, health official at the national and sub-national level, laboratories, institutions, but I also had the opportunity to visit the most affected municipalities and spoke with individuals, communities, and the country's religious leaders. So let me now go straight to the main observation from the mission. First, the response that the government put in place was strong, agile, and early. And I've been very impressed by the dedication of the health workers, public health officers, and all those working tirelessly to protect people from COVID-19. In concrete terms, setting up the response was early, even before cases appeared in the country. Starting from a strong testing capacity, allowing to identify patients from the early stages of the pandemic. but also an agile repurposing of the facility, allowing the patients with COVID-19 to be cared for. But also something that impressed me was the ill protection of older people in nursing homes, which avoided the many deaths we have seen in other countries. We fully understand that the socioeconomic impact of public health measures are of concern, as they put people's lives and livelihoods at stake. However, health and economic interests do not have to be in contradiction. The response needs to be more nuanced, and public health measures need to commensurate with the level of disease transmission. Elasticity and scaling at local level is key here. Resurgence of cases can be managed, and in the future, all efforts should go towards preventing amplification of outbreaks. This is possible if the government and the community join hands tightly. North Macedonia, until recently, was a very good example of response in the European region, and it can go back to that again. We recommend the government to strengthen, to identify, isolate, test, trace, contact, and quarantine them. What we know is that to cut the chain of transmission, every case needs to be isolated, cared for, tested, and every contact needs to be in quarantine. It's important to keep those that are isolated and in quarantine in adequate setting. This should be done with the full engagement of the community. All those who are sick should right away self-isolate themselves. Also, we need to monitor emergence of new cases and make use of real-time data so that we can be ahead of the virus. And as we go forward, we need to maintain essential health services so that patients can be cared for. Another recommendation is to avoid or properly manage gatherings or crowded places. This is to avoid for the virus to pass from person to person, and introduce, if needed, targeted control measures. That these should also be scalable. However, and I like to stress this point, this is not only a whole of a government responsibility. The entire society is part of this effort. It's in every individual hands to ensure that all positive cases are found and isolated, and that all contacts are traced and quarantined. It's only by cutting the chain of transmission that we can stop COVID-19. It's in every individual power to continue cleaning their hands, covering their cough, keeping safe distance from other people, and where appropriate, wearing a mask. We know that this simple, smart measure will keep yourself and your beloved one safe. It's in every influencer, community leader, and journalist voice to speak to the facts, relate to people's perception, and foster protective behaviors. This is paramount. This speaks to the whole of a society commitment to everyone's health, and to health as a determinant of the economy. Let me conclude by saying that this is not time to lower the guard. Instead, we should only expand the good work done so far in identifying and isolating suspect cases, testing them, isolating the sick ones, and tirelessly tracing contacts and quarantine them. Now is the time to re-engage the whole of society to identify cases and their contacts early and continue protective measures. This is the only way to be ahead of the virus in this fight. Failure to do so can result in explosive situations that will require dramatic measures, affecting economies in a much broader scale. We at WHO reiterate our full support to North Macedonia and are prepared to extend our efforts in strengthening the current response efforts to protect citizens' lives and livelihoods. Thank you.
Ви благодарам многу за излагањата. Почнуваме со поставување на прашања од страна на новинари.
Thank you. We are going to continue with the questions from the journalists. I would like to ask you, before you ask the question, before you raise the question, to address to whom your Mr. Scano. Good afternoon. You said it's not time to put the guard down and that we need to have more control of the people that are put in quarantine. How do you comment the situation that we have increased number of cases in the North Macedonia, in North Macedonia and in the region? How do you comment on the measure of alleviating the measure regarding the border crossings? Do you think that this measure will enable increasing of the cases, and do you think that some of the measures that were undertaken by the countries were early, maybe? Thank you.
There are several questions here. Can you please repeat the last part of the question?
The question is, do you think that with the alleviation of the measures for the border crossing without any testing, do you think this will be a threat for North Macedonia? Do you think it will enable for the spread of the virus in a bigger extent? And do you think that opening of the malls, of the shopping malls or the fitness centers are maybe too early? Do you think that this alleviation of this kind of measures is a bit early?
So, there is echo. So let's start from the first part, and it's about the resurgence of cases. That we are not seeing only in Macedonia, but we're also seeing in the region, but also across other European countries that they were on the declining phase of the curve, and they were easing control measures. Resurgences are not part of the life cycle of the virus, either man-made with irresponsible behavior or because of choices of course, of control measures by the countries. What we are seeing is that this virus is not going away. And actually, that as soon as we lower our guard, it comes back. But what it's also important to notice is that resurgences can be managed. We are in a different phase of the epidemic. In the first phase, when we had explosive cases, we were very responsive, trying to save lives as much as possible, and also to deal with a huge number of cases that they were sick. Going into the future, the systems are growing, are learning from the past. They are becoming more sophisticated in the sense that they have to learn on how to immediately identify the cases and avoid for amplification. So this is the main point. The whole policy is about individual behavior and policies that minimize the risk of spreading of the virus. But as soon as we identify one case as early as possible, we have to make sure that that case doesn't transmit further, and especially that the outbreak is not amplified. And the individual responsibility is crucial. It's crucially important if someone feels sick to immediately isolate himself and to immediately get tested and to be truthful about who the contacts are. It's only through individual responsibility that one nation and the world as a community, we can overcome COVID and control the epidemic. In terms of individual measures, and the specific one is the border crossing, we are seeing that countries are easing and they're starting opening borders. Of course, these are difficult decisions, but it's not necessarily that there is a binary interpretation of health versus control measures that can be also restrictive. In the future, we have to be much more nuanced in the sense that we have to be prepared to identify case early and to control outbreak without these big they explode, they become amplifying or spreading events. But at the same time, if there is a need, we can be much more selective in the type of the intervention of control measures that is implemented. And we are seeing this across Europe over the last week. So what is important when we are opening the border is that if a case happens, whether this is reintroduced or whether it happens in the country, we have to be able to identify it as soon as possible, to isolate them, to take care for, and to identify all contacts with them.
Благодарам многу, Тамара. Одиме со следното прашање, канал 5, повелете.
Благодарам, и моето прашање се однесува на гостиното од Светската здравствена организација.
Health Organization, Dr. Fabio Scano. Regarding this question, I would like to check the map. Dr. Scano, as you can see, this is the map from the website of the World Health Organization, and it refers to the number of the death cases in the region and worldwide. This number refers to the death cases to 1 million of population. We can notice that Macedonia is the only country colored in brown. All the other neighboring countries have lighter coloring on the map. This is information from noon today. We have 112 deaths per million. If we look at the map, it probably refers that according to these parameters, Macedonia is worst ranged in the region regarding the number of death cases as a result of the coronavirus. Could you please explain what are the parameters that are being taken into consideration, and is this map indicating that Macedonia is worst ranged in the region? Thank you.
What I think is important to say is that every death needs to be counted. Countries are going in a different way of counting deaths, and it's also extremely common during an epidemic that you go retrospectively and you see the number of the deaths in your country, because sometimes they are counted differently, like you don't count deaths in the community, you only count in the hospital, or you count only the confirmed cases and not the probable cases, and so forth. What I can say is that actually North Macedonia has been extremely transparent in sharing not only the data, but also the information about people who died from COVID. This is extremely helpful because it improves the knowledge about the diseases and the action that can be taken. In WHO, we don't. I think it's very important point to highlight that, and we have learned this lesson, that it's not really helpful to compare countries. Every country is different. The context is completely different. We have to wait well sometimes into the epidemic to see also how the recount in other countries will matter to compare figures. But we have also to learn from these 4 months, both in the country and globally, and to see how to improve mortality and how to make sure that we diagnose patients early enough so that they don't get to a stage of the disease where mortality is more common. But also to protect those patients, especially with underlying diseases that we know there are more risk of mortality, by being responsible and by being able as an individual to protect ourselves. So the mortality data are important data. It doesn't make much sense to compare across countries, but they are really important for the understanding of the disease.
Благодарам многу. Одиме по...
Thank you very much. Let's move on. Cital Television, yes. Good day. My question is to the Minister of Health. Tomorrow, Minister, border crossing points are going to be open without any obligations such as PCR tests and compulsory quarantine. Does it mean that tomorrow the hotels where the people would come to the country and were quarantinized, is it the end for those? And what happens with those citizens that before yesterday, entered the territory of the country, showed a negative PCR test, no older than 72 hours, but still have to be in compulsory self-isolation? Are they going to be free as of tomorrow, or are they going to be still in quarantine until 14 days are over? First, let me give you some information about this decision, the background to this decision. According to our analysis, since the 21st of June, 20th of June, the R0 factor, which is below 1, we think it's a good trend. I'm going to repeat that all these analysis and all these numbers, I will speak about it with a dose of reserve, because there is always a risk that there could be some outbreak that we haven't anticipated. We are one of the rare countries in the regions that had their borders closed, and in that sense the recommendation was that borders be open. Very low percentage of the total number of people who were sent to quarantine developed symptoms. We are talking about a few dozen out of thousands who were quarantinized. To answer your question directly, we are looking now for the legal solution with this group of people who have crossed the border the other days, yesterday, before yesterday, will be free from staying in the state quarantine. Now, our lawyers are working intensively on making an adequate legal solution for this. They are close to adopting this decision and publishing it, and it will be applicable for all those who entered the country and are now in state quarantine or who are in home isolation based on the results of their test. Thank you. Let's move on. The next are Television Alsat. Hello. Question for the minister. Several days ago, you said that the numbers will decrease over the next days, but we see that the number is high from one day to another, both in the capital and across the country. The first question is, when are we really going to see reduced numbers, and is there any specific measure in view about Skopje and some municipalities within Skopje with the highest numbers of cases? I said about the R0 factor and its calculation. We are monitoring the situation, tracing the contacts. We are putting people in isolation. The pressure on the hospitals is not such as it was in the beginning of last week or the previous weekend. There are fewer admissions now compared to last week in the hospitals, but at the same time, some patients were cured and left the hospital. I would like to say that the tailoring of the measures depends on several factors, such as the capacity of the hospitals, information about who the patients are, what their contacts are, how one can trace the contacts, the veracity or the accuracy of the information they are giving. And that's how we came up with these alleviating measures. Everything is based on the protocols. So this has been the position of the Committee for Infectious Diseases. We are very carefully and closely monitoring the situation. And of course, there is room for interventions maybe in the future in a certain region or maybe in a certain neighborhood or settlement. But at this moment, there are no such indications to come up with such measures. Once again, I will say that by abiding by the measures, everybody can make a contribution. Thank you very much. The next ones are Alpha TV. Thank you very much. My question is also for the Minister, Venko Filipce, the Director of the Skopje Center for Public Health, said that he personally was to thank for the recommendation for the border crossing points to be open without PCR tests. And the goal of this was for the Albanian diaspora to be able to come for the elections on the 15th of July. So my question is the Committee for Infectious Diseases adopting political decisions? And maybe this is way how they try to make up to politicians. I read that statement. It's totally untrue. First, Director Ziberi of the Center for Public Health in Skopje is not member of the committee. I think this is pre-electoral rhetorics, and this is cheap pre-electoral rhetorics. The director will gain nothing from this statement. In the past, the committee has based all its decisions on science, on medicine, and I think this is an improper statement, especially for a doctor and for a leader of such an institution such as the Center for Public Health. And if it is possible, I will consult the lawyers, the director will be replaced. Changed and replaced. Next, Television 24. My question is for the WHO representative. Do asymptomatic cases spread the virus or not? What is the knowledge of WHO on asymptomatic cases so far? And for how long they remain infective or carriers of the virus? And to be a threat for infection, the asymptomatic cases.
Thank you. Thank you for the question. Maybe I start also from the middle of the question. WHO has updated the guidelines for declaring cases cured for the asymptomatic patient is from 10 days from the diagnostic test that is a PCR. As you know, WHO is an evidence-based organization. We collect the evidence, and when this evidence is robust enough, we issue and we update guidance. In terms of asymptomatic, they need to be isolated. The extent to which they transmit is still under evaluation because we are collecting multiple evidence from different studies. But definitely they need precaution like other patients. Sometimes when they are detected, they are asymptomatic, but a couple of days later they become asymptomatic, they develop symptoms. And this is also very important because we also better understand how the disease proceeds. It's a very complex issue, and it's an important aspect, of course, of this pandemic. And we hope that more evidence will come up in the future and it will be evaluated, and of course, guidance, if needed, will be issued.
Благодарам, Ивана.
Thank you, Ivana. Nova TV. my question is also for Dr. Fabio Scano. Is there a difference in the strength of the virus from country to country? And why in Macedonia is the virus so strong in Macedonia so that even young people end up on a respirator machine? They come to the hospital seemingly well, and during the evening they are on a respirator. Does WHO have an explanation of this? And is the virus maybe mutating from day to day? What is your explanation of this intensity of the virus?
Thank you for the question. The WHO collaborates with many research centers, and right now, because of the efforts of all these scientists, I think that more than 40,000 samples of the virus have been sequenced. And what we know is that there are, of course, a little mutation, but not that they explain a difference in virulence or if one virus in one country is stronger than another. Epidemic is very complex. In every country is very different. For instance, in Macedonia, the average age is 44, so it's a younger population. You might know that in other countries is much higher, and of course, if affect a higher population that generally has also more underlying disease, and mortality can be bigger. Sometimes people arrive very late to the hospital. It's not very much due with the virulence of the virus. There are so many factors that also play a role. But back to the original question, there is no evidence so far that one virus in one country is stronger than another. And WHO continues to collect the evidence and to monitor potential mutation of the virus.
Благодарам.
Thank you very much. Televizija Tera, your question. Greetings from Bitola. Question is to the minister, Filipce. Today in Bitola, we have one in recent 12 new cases, and also at the clinic in Bitola, we have 44 hospitalized patients, so more than 10 or 12, which is the number yesterday. Has the situation changed somehow, given the increased numbers? And to what extent have the measures been effective? Today we have 12 new cases. I think they have been effective in the sense that we identified persons who were working in those factories and could be transmitting the virus if the modus operandi was going to remain the same. A similar measure we undertook in Štip, and in a short time, the number of cases went down there. I think this was a good measure, and I think that the local operation center or crisis center did a good job. The hospital is not jeopardized at all. So after the discussion with the director yesterday, we said that there was additional capacity. The staff has been new staff have been assigned to help the existing staff. So they came from other public health institutions, from the lung disease hospital in Oteševo, namely, and from the hospital in Ohrid. And also another doctor was sent to help the triage group. So the hospital is still safe in the sense that it's not overwhelmed, because we already have a plan where we could put additional patients if needed in the big building of the hospital, but there is no need for that so far. Today, the local crisis group in Resen had a meeting, and they decided that the factory should not be opened until 3rd of July. So the measure was continued, and I think it's a good measure. And I think that this way of localized measures and restrictions and what the epidemiologists are doing with contact tracing, with the analysis, will give results. Thank you very much. The next, Slobodan Pečat, journalist. Thank you. Minister, tomorrow, the list of 138 patients will be published. These are people who have not received decisions from the State Sanitary and Health Inspectorate. And regarding those persons who did not receive decisions or orders for isolation, how are these persons going to be controlled when they cannot find them at home to summon them, to serve them this decision? How are they going to be controlled? How the police is going to enforce the control system? Have you discussed on this topic? Yes, we discussed. First of all, it was a challenge to how to find a way to publicly publish the list of the names after we have consulted the Agency for Data Protection and so on. We are talking here about 138 persons who are supposed to be served decisions who were unavailable for the inspectors of the State Sanitary and Health Inspectorate. I presume that the police, with more intensive work out in the field, with better knowledge of the field, of the addresses and so on, will be able to reach these persons, because the inspectors were working intensively, but there were a huge number of decisions that they needed to serve the people with. So these are, we have a limited number of inspectors, and I believe the police can do this job much more efficiently. And these people could not be reached even by the postal service. So even the postal service could not deliver the decisions to them. Thank you very much. On the official mail of the Ministry of Health, we received several questions. Let me read them. The first questions are for Dr. Fabio Scano. Please come to the floor. The first question from TV24 is whether asymptomatic cases of coronavirus are spreading the virus or not. What is the knowledge of the WHO on asymptomatic cases so far? And for how long are asymptomatic cases contagious? For how long they can be carriers of the virus and be a threat to other people?
Thank you for the opportunity to elaborate more on the question that it was also asked earlier about asymptomatic cases. Again, as WHO, we are collecting evidence from studies on asymptomatic cases. They are definitely part of the epidemic. What we know, and it's also common practice in the countries, is that these are identified when you test the contacts. And of course, they are positive to the test. Some, they might develop symptoms later on. Others, they don't develop, they remain asymptomatic. The same precautions applied that for patients with symptoms in terms of self-isolation. WHO very recently issued the guidance on basically in terms of when the patient can be considered cured, and the guidance is 10 days from the initial PCR test, in case the country doesn't have the capacity or it wants to prioritize the testing. It's still a matter of studying. There are quite few studies that have been collected by WHO that is collecting more robust evidence to come with more guidance if this will be needed in the future, after a thorough evaluation of a range number of studies.
Ви благодарам многу. Сега одиме со прашањата.
Thank you very much. Now for the Minister of Health, Dr. Filipce.
What is the reaction to the latest decision by the government that does not allow musical events to be organized in an open space? Do you think this decision needs to be alleviated regarding the fact that the fitness centers and the malls are going to be opened? We had meetings with several entities that are organizing events in the area of culture. We have agreed that their proposal for a protocol is going to be addressed by the Commission. I have to say they have a very solid protocol regarding the measures to be undertaken. And after that, we are going to adopt a decision. There are certain topics we need to discuss, how many people will be allowed in an open or closed space, but we will discuss this tomorrow. Thank you. The last question, the companies that are required to engage security officers in front of their buildings or facilities, are they still going to have to be obliged to do this? And until when? Everywhere, this should be applied everywhere. All the mechanisms that is going to enable respecting the measures. There are certain institutions we are witnessing that the citizens are respecting the measures by themselves. There are companies or institutions that have marked their entries, but where we have the potential risk of certain crowding of the place, we consider that there will be continuation of the measures. Thank you very much. This was the joint press conference of the Minister of Health, Dr. Venko Filipce, and Dr. Fabio Scano, the Senior Advisor of the WHO Europe. All the remaining questions that are going to be sent by email are going to be responded during the day today. See you at the next press conference.